Hi there. Welcome to the Lifestyle Herbalist podcast, where we hope to bring you a healthy dose of happiness. I'm your host, Dabney Vaccaro, clinical herbalist, health coach, lover of plants.
And I'm Sabrina Cooper, registered culinary holistic nutritionist and herbalist. Join us as we dive into the art of herbalism, mindfulness, and healthy lifestyle practices to help you achieve a happier and healthier life. Whether you're a seasoned herbalist or just starting your wellness journey, we're here to provide you with the insights, tips, and inspiration for a more balanced and joyful existence. So grab your favorite herbal tea, sit back, and let's get a healthy dose of happiness together.
Hey, welcome back to the Lifestyle Herbalist. Sabrina and I are here today to talk to you more about oral hygiene, dental health, and some of those silly questions that might seem silly to our patients, but are very serious for us. So we're going to dive into why we ask the things we ask and say the things we say. Are you ready for this, Sabrina?
I am. I think it's a really important topic. And I sort of touched upon it on the last podcast. And I know, Dabney, you talked about a few things that we kind of look for or talk about in our dental, not diagnosis, but when we overall the treatment plan, we talk to our patients about medical history and things like that. So I just felt that it was just really important as well to bring to light the importance of your dental hygienist and the job that she has to do, or he, I shouldn't say she, they have to do. And also just because these questions really truly are important. And sometimes people don't tell us everything, even vitamins, minerals, all that kind of thing. People are like, well, I don't think I need to tell you, but it's just good to know. So if there is a contraindication or anything like that. So I think we should just dive into it. And just Dabney and I are just going to have a conversation on maybe things that we've seen or bring importance to the questions, those silly questions.
Yeah. Well, when a patient first arrives into the dental office, typically they check in, and then the hygienist or the assistant, whoever, goes out and greets the patient, brings them back. One of the first things we usually ask, besides, are you having a okay day? How's your day going? Get the niceties, we want to have good rapport with our patients, of course. We want to get to know them on a personal level. But, aside if are you having any tooth problems or tooth concerns, let's talk about your medical history and why. Many patients don't see the value or the necessity of why somebody would ask about a medical history. Like, you're just here to clean my teeth. What's my medical history have to do with my teeth?
Right.
Glad you asked. Sabrina, why would you ask somebody for their
In the
medical history?
world.
For crying
We're
out
just-
loud, you're
and
only
we're-
a dental hygienist. What do you
I
need
was
to know a
gonna say,
history for?
We're just, in quotations, a dental hygienist. We just clean teeth. We just look in your mouths and pick out the gross stuff that's in between your teeth,
You just polish, pat
That's
things
all we
up,
do.
and then
But,
send me on my way. Why in
but
the world do you need to know what medications I'm on or any of that thing? It's none of your business. What do you want that for?
Exactly. Or you'll wait till the dentist comes in because they're the healthcare professionals. However, we do study, we do have our due diligence, we do take courses. And to be honest, we are the first ones in line that see you before the dentist does. And most times we see the things that are underlying that a dentist will not discover until we point them out. So I just wanted to say that, that it's these little things that you need to know that your hygienist actually knows what she's doing and she's there to do just more than clean your teeth. So on that note, when we ask about a medical history, things can change from, even if you're on a 3-month cleaning, routine for your teeth or checkup, things can change in that 3 months pretty drastic. Like you might have gone to the doctor that next week and something may have come up, or you may have gone on a new medication or off a medication. You might have changed your dose. You might have tried out a new vitamin. So there's all these things that we kind of need, well, not kind of, we need to know because certain medical conditions can impact dental procedures. They can also impact your overall health that we've talked about, systemic health. And so, for example, if you've all of a sudden you had a heart attack and we didn't know, or a heart problem, and you went in for surgery after that dental cleaning, 6 months later, you come to the dentist, we need to know that. So you might need a pre-medication before you get a dental cleaning because that bacteria goes into your bloodstream. That's just one example, right, Dabney?
Yeah.
So these are some of the things that we really need to know And sometimes people think, oh, it's just a teeth cleaning, but there's more to a dental cleaning than meets the eye. So,
Yeah. One of the first things hygienists do is something called an assessment. That's when we're looking at the patient. And I know we're turning and looking at you as we're walking in, but I'm gauging how are you walking? How's your gait? What is the color of your skin? There's a whole lot of assessment that happens between the greeting and the time you sit in my chair. When you sit in my chair, I'm going to ask you some questions and want to know, like, how strong is your voice? How are you looking like you're feeling today? Those give me clues as to are there underlying issues going on? The next thing I say, well, tell me about your medical history. Are there medications that you're taking? Why is that important to me? Is because it gives me a better understanding of when I actually look in your mouth, what I'm actually in for. So the number one side effect almost every single medication has is xerostomia or dry mouth. And if you're taking multiple blood pressure medications, I'm going to anticipate there's probably not going to be a lot of salivary flow, and that's going to raise your caries risk to be a much higher level. If somebody is not taking any medications, I then ask, well, when was the last time you had a checkup? If somebody says, oh, I don't have any medical problems, I've never been on any medications, wow, that's great. When was your last checkup? Oh, it was about 5 years ago when I went to the doctor. No
red
blood
flag.
work, no blood work, nothing else. So then it kind of gives me a better understanding, again, what I might be noticing. Because if I'm noticing somebody has chronic inflammation, they're bleeding, like I'm looking at their gums and they're just oozing at me, I'm thinking maybe it's time to go get a checkup, do some blood work, just to make sure there's nothing else going on in here aside that maybe you just need to come to the dentist more often. Maybe we need to talk about some different home care products. Like there might be something to that systemic connection because remember, our mouth and our body is not separate. Our mouth is the window into the rest of our body. So, like Sabrina said, if somebody had a surgery, it might be that your doctor required you to take a pre-medication prior to your dental cleaning. If you just had a heart attack, you're supposed to stay away from the dental office for 6 months because the number, well, if you've had a heart attack in 6 months, it's a greater risk that you'll have a second heart attack within 6 months. And we all know that dental offices can be a bit stressful for some people. Sabrina and I love to go. We do not get stressed out at all. We love it, but we know not everybody shares our reflection. So it's really important. If you had a stroke, if you had, anything like that, like that's a red flag, and we need to know that prior to going in.
Like even chemotherapy or some people, like because things happen. Like I had that happen to a patient and it was like totally fine, no medications, no nothing. Everything was great. Next week went for a doctor's appointment, doctor's visit, and breast examination, and found out she had breast cancer within that, and was starting, she was going for an appointment and everything else. So it all kind of snowballed. So it's just that was 3 months. And so that's why I always say it's just really important because, like you said, she never did go for her checkup and she was due like that yearly checkup or whatever she does go to the doctor. So things changed for her and she was pretty healthy. You know what I mean? No symptoms, no anything. So sometimes, like you said, it really is important. And if a hygienist suggests, or a doctor or a health professional like a dentist or someone suggests that you see or refers you back to your doctor for something, we don't want you to get worried and stressed out that we're sending you there. We're just making a suggestion because we just want to make sure that everything is clear. And some people get anxious, like, why, oh my God, why would you stress me out? It's like, and now I have to go to the doctor, like something's wrong with me. But it may not be. It's just like maybe it's just a little bit of a fix or a medication that's too strong or something that can just be adjusted, right? Like, or it could be something more underlying. But, we try not to stress you out about it, but we're doing our due diligence because we've seen something that's been a red flag for us. And that you should appreciate instead of being stressed out and be like, you know what? These people are doing their job and they're taking good care of me and they're in the health profession that, you know, can
Yeah. And
guide
they're
me where I need to
really,
go instead of just being like, why are they telling me this? Because we've had that. I've had that where people will be like, they're so stressed, that we have said this. And then maybe it ends up being nothing and they get very angry. But it could lead to something. So
Really, we're just trying to rule things out. And it could be
exactly.
nothing, and we're hoping it's nothing. But, before we start talking to you about, another toothbrush option, are you not cleaning in between your teeth with something? Try this rinse, try this, try this. But before we send you out the door with $140 worth of products, maybe it's wise just to get a checkup so we can rule out any underlying issues because $140 worth of products is not going to change and get to the root of the issue if there is something underlying. Because dental hygienists and doctors, dentists know that there is a direct correlation between people who have diabetes or a chronic inflammation and gingivitis. And I've had patients, as I'm sure you have too, Sabrina, who come in, they're very put together. There's basically no plaque on their teeth, which is the soft stuff. There's very to little no calculus, which is what people call tartar, but yet their gums are inflamed and bleed so easily. And so gums are not supposed to bleed. They're just not. And when I ask a patient, how often do you notice your gums bleeding? They'll say, oh, they've been bleeding my whole life. Well, I'm sorry, that's not normal. Why hasn't anybody had this conversation with you?
That's right. And it could be simple as just a nutritional fix, right, Danny? Sometimes it's not like like it's a crazy thing. It could just be like diet. And sometimes I ask patients like about their diet when I see that, that's been chronic because
And it could be even an allergy, a
it
food
could be an
allergy. If
allergy, it could be
somebody's,
mouth breathing, it could be,
yeah, there are so
something
many
that
different
you're
things.
not sleeping well, and then all of a sudden you go to your doctor and say, you know what, my hygienist said that my gums are really red and inflamed. I've been mouth breathing a lot. Next thing, they're sending you to a sleep clinic, and now you found out that you had sleep apnea, which could save your life. You know what I mean? So, I mean, these are things that, or you have, right?
Yeah.
It's something that, and then I also had, no joke, had a patient like a couple weeks ago that had same thing happen, swollen inflamed gums, talked about like sleep, well, talked about my husband who had sleep apnea. And he went to his doctor. I guess it must have triggered something in him, like saying, hey, maybe I should check this out.
Hmm.
And ended up getting like CPAP machine and is totally like face skin was better, looked more relaxed, tissue was starting to heal. You could notice like significant differences in the person's personality, like face, like everything, just less tired. So I just think we have to just bring attention. And the point of our thing here is that we just really want people to share this podcast and know that we're not just teeth cleaners, right?
No.
And we have a lot to offer people. And I don't know about healthcare, and I know it's different in the United States, but right now our healthcare system here in Canada is, a little lacking. So we have some issues. So, like we really have to take health into our own hands a lot of times. I'm sure it's the same in the US. Some people don't have coverage and they have to pay out of pocket. So why don't you do these small things and take care of your health and diet, so that you don't have these big weights and bills and things like that, right? Like,
Oh, it's so true. Just coming to the dentist and people will fall off their normal hygiene routines if they've had a change in jobs or they lost their insurance and they think, well, I couldn't come to the dentist because I didn't have insurance. And I would just like try to reassure them I understand the financial consequences. However, it's better to come once a year just to get things checked out
mhm,
because staying away from the dentist typically is going to cost you more than if you were to come in your appointment time. Because if you've gone away from the dentist and a little cavity becomes a big cavity, and then the big cavity becomes a broken tooth, instead of us seeing like, oh, there's a little white spot, let's see if we can change things around. Here's a little fluoride, here's a little hydroxyapatite, change up, some of the coaching to change up some of the things you're doing with your diet. Maybe we
yeah.
could have kept that white spot from even becoming a full-blown cavity. But now you were away from the dentist. You didn't know the white spot became a cavity. You didn't know that the cavity was going to become a broken tooth. And now you're looking at, $2,000, $3,000 to fix the tooth or an extraction. And you will have saved no money.
That's
No
exactly
money.
it. It's exactly it. And I think it goes with anything. I mean, if you put a little money aside for your dental cleaning or a dental visit, you'll realize it's really not that much. per day. You know what I mean? Like if it's 100, let's say just a basic clean, I don't even know. Like I'm saying in Canadian, so 200, let's say $200. That's I'm just throwing it out there, 250. But over a course of that, there's how many days in a year? So it's not even $1 a day that you need to put aside to go to the dentist for one, one dental visit, right? Yeah. So really it's something that's doable and it's disease prevention. It helps like with all your body because we can't like stress it enough that what happens in your mouth also is in your body, or in your body your mouth will show you as well. So it's
Mhm.
that we talk about brain gut connection all the time. Oral health and systemic health go hand in hand as well. So, sometimes even people are like, oh, that person has like the worst bad breath or halitosis. It might not be from their mouth. It could be something systemic, right? We know that. So sometimes it's not just like a periodontal disease, but however, bad breath usually means that, there's different when you're a hygienist, sometimes you can tell. Can you tell, Demi? Like
Oh,
you can
there's
tell
definitely
like
an odor. Oh,
systemic
yeah,
or
yeah.
like dental, right? Like we have this nose now that's kind of,
Yeah, yeah.
but if there's halitosis, there's more than just eating garlic and onions. So
Yeah.
um, you really
And
need to be
can
aware of that. There could be decay that's starting. There could be, an issue with your gut. So, um, that's also a sign that you need to like see someone. And people will be like, oh, I got an appointment with my doctor. And if it's oral health, I bet you 9 out of 10 times the doctor will refer you back to your dentist because they won't have a clue of what's happening. I had a patient and they had like angular cheilitis, so like,
Mhm.
redness in the cheeks. And she's like, oh, well, I made an appointment with my doctor because it just started all of a sudden. But we had already given her all the protocol, what to do and what everything. And so I'm curious to see now when she comes back what the doctor had said to her after but we said, go anyway, just in case, right? Like, is it do your due diligence? So it'll be interesting what they come back with.
Hmm. How do you coach your patients with somebody who has angular cheilitis?
Well, we talked about diet first because she had eaten a lot of spicy food, so that was like the onset of it. And so at first it was kind of just red, and it didn't even really look like it, so that's why we were kind of treating it. And
Hmm.
then both the dentist and I were talking about keeping it moist and keeping it like there was like a product that we had suggested to her to use, and she said it was clearing up. So I think it was kind of at the end of it.
Hmm.
But that's kind of what we do. I don't know. You probably might have a better vitamin or something to
I've
use.
had very good success
Vitamin
by
E.
vitamin E, just
Yeah,
getting a capsule and poking it with a pen and just
yeah,
squeezing the vitamin E right on it.
yeah,
I had a patient who um, she was an older lady, and so she just had, her skin had just kind of, sagged down a little bit, and she had just folds of tissue there, and I think it just stayed moist, like from her saliva.
yeah,
And so she just always had cracks on her mouth, and so she happened to be in my chair that day, and well, she was one telling me that she's had just cracks on there for like years, and she says she puts cream on it, but it always just keeps coming back. Anyway, I had suggested to her to put the vitamin E on it. Anyway, when I saw her 3 months later, she says it went away and it hasn't come back, and she was so excited.
yeah.
So,
Vitamin E like is probably the most common to use, but yeah,
mhm.
there's a product here that you know dentists seem to like again
Yeah,
suggest, and they seem to
mhm.
listen. So
Yeah,
okay.
as long as it goes away,
As
right?
long as it goes away. But like I said, it was kind of funny. It was interesting because she had said she had like spicy hot wings and that she thinks that that was how it started because she didn't have like deep grooves or anything like that. It wasn't really, it didn't even look really that bad. So I
Interesting.
don't, so it was just, she felt like it could have been an allergic reaction. So that's why we kind of felt like it was, like, you couldn't tell because she's like, well, of course today it's better because it's always the way when you make an appointment, it usually goes away. So, um, yeah, could have
Yeah,
been a one-off, right? It could have just been an irritation and it could have just been the spice. It was because she says she doesn't usually eat spicy food. So it could have been something that just kind of burned like areas and she was overly sensitive. She's out in the sun a lot too, because that's her job. And I thought it could have been something with the sun.
hmm
But
yeah.
Anyway, so I just feel like overall, like we really do like we also do like exterior too. We don't just do intraoral exams. We also do like the exterior of your face and skin and the different glands we check in your throat. Well, throat's intraoral, but we also check all of that as well. So, you know, because we can catch things. And that's why when Dabney was asking about, we ask you about changes in voice or things like that, it's because like we want to see if you've noticed something wrong. There could be something with your throat or a gland that you haven't realized and play it off. So I think it's one of those things that just really be mindful and tell your hygienist exactly what's going on. And that way we can tailor treatment to your individual specific needs because that's what we do. We don't just have a one size fits all. We really do look at all the information that you give us and we put together a personalized treatment plan. Um, we also like to minimize the risks if there's anything that you are dealing with for tooth decay, also interactions with medications. If we have to prescribe well, not us, but the dentist has to prescribe, say, an antibiotic for an infection or something, we need to know what's going on. If you're on a blood thinner, we also need to know that upon other things, but these are kind of the main ones. And we also want to promote your overall well-being. So we're really just concerned on how we can have you create healthy life choices and that are in connection with your oral health. So
Yeah.
that would be
I
my
I
tidbit of
don't think
information.
yeah. And I don't know that everyone is fully aware of the requirements that's necessary to become a dental hygienist. Like we take typically 1 to 2 years of classes before we ever get into a program. And it includes microbiology, anatomy and physiology. We have hidden neck histology, hidden neck biology. We have to take radiography. There's dental
Oncology.
materials, there's algebra, there's chemistry, biology. There is such a whole host of information. Then we have to go into the clinic where we spend hours every week working on each other first, and then with with our patients learning just the tactile importance of holding the instruments, how to instrument, how to talk with the patient, how to do perio charting. We have such a very rigorous training that it's it puts us apart from other members of the dental team. Dental assistants, goodness gracious, I'm glad we have dental assistants. They are truly the workforce of the dental practice. They assist the doctors. They bring their instruments to them. They hand them the instruments. They clean up after the doctors finish with their procedures. They bring the patients back. They tell the doctors when they're ready. They take the patients out. And so they primarily work with the doctors. And the hygienist, we primarily are just our own little solo practitioner in our own little room. There are some practices that have an assistant that helps the hygienist, but primarily, we are with the patient almost the majority of the time. The doctor comes in for a 5, 7 minute check, but then they're out the door, and we are then there to help wrap things up, talk over any questions that they might have, and reappoint them for their next appointment and get them to their next place. That's why the doctors really rely on the hygienist to gather information like the medical history to know, is there something going on with the patient, mouth or tooth, so that we can start the investigation and start to answer or ask some of those important questions so that it doesn't require the doctor to be in the operatory quite as long. So we are definitely a provider that is well equipped in answering questions and helping a person to navigate their oral hygiene, their oral health. And we are the coaches and really the ambassadors for the patient to try and get them healthy. So that's why we ask these silly questions that might seem really annoying.
Well, and if your health dental professionals aren't asking you these questions, I've said it in my podcast earlier, it's like you should ask why they're not asking you these questions because, or look, like think about why they're not asking you, because they should be asking you. Every hygienist should be asking, or at least your dentist should be doing it. And it's not just at your new patient exam. It should be at every visit. There should be spent time should be spent finding out about you, getting to know you, understanding different things that have happened, just because it really, and it needs to be charted and known. So everything is in your chart, and we're not doing it to be nosy. We're not doing it to like divulge information to the rest of the community. If you live in a small community, it all stays within our office. There's privacy, policies that are in place. It's just like going to a doctor. And like I said before, it's just doing our due diligence. No different than if you went to your doctor and they sent you to a specialist because they need to know more information about something that you have, or they're not familiar with what they have, they'll send you to someone else. It's the same with us. If we don't know, we send you to oral surgeon. We send you to root canal specialist, orthodontist, also your medical doctor. We might send you to an allergist if we don't, something seems to be going on in your mouth that's causing this. So just know that we're all part of a health professional team. And we're not just people who clean your teeth. We're a lot more than that. And we have a lot of value and a lot of knowledge. And like Dabney said, we study a lot and we go through a lot. And
Yeah,
we're
deep
ready.
cleaning actually is probably the last thing we do because we're doing the
Yeah,
medical history,
I
we're
know.
assessing,
So
and
true.
we're
The
doing the
x-rays
oral,
and
we're doing the head and neck exam. People ask me, what are you feeling for? It's like, well, I'm feeling for any lumps or bumps, anything that's, if your thyroid's full, I'll ask you questions about that. I have them, feeling for any lymph nodes that might be swollen. And I had one patient in particular, like one lobe of her thyroid just felt a little bit more full than the other. And so I mentioned it to her. She went to her doctor and she says, my thyroid's fine, but I'm glad I went because I found out my iron was low. So now I am taking some iron and I'm feeling so much better. So thank you. I mean, it was, I had her go because of one thing, but she found out there was actually something else going on. So,
yeah.
our body is amazing and it can heal itself, and anything should be self-limiting in a couple weeks. But if somebody mentions to you that you have a swollen lymph node, I usually have my patient come up and palpate it so that they can feel it and know where it is. I was like, if that's not gone in 2 weeks, I'm going to suggest you follow up with your doctor because you might have something, long term or something that needs to be treated. So typically after 2 weeks, it should go away. But if not, please follow up because we care about our patients. It's more
Yeah,
than just a hygiene visit. It's the whole person. We're really trying to assess what's going on in the rest of the body.
I love it. And we make suggestions too. I mean, some of us have more than one discipline. Like we're not Dabney and I, we're like herbalists and nutritionists. And so we also can offer a wealth of information in that sense, which is great that you can offer different options to patients. There's some patients who want to go all natural. And so it's not just like turning a frown or putting, them to the side and being like, oh, this patient just wants to be natural, like they don't want the typical like appointment, but it's like treating it with compassion and knowing that there are options, right? Than the everyday, right? I know a lot of hygienists will be like, oh, I don't know what to say. I don't know what to do. And this could be another podcast for people out there is like, what are options if somebody wants a more natural approach to dental care, right? To dental treatment? What can we do for our patients? And so that's part of the package, or someone who doesn't want to have x-rays, explaining to them why x-rays are important and how they benefit us again with the whole personalized treatment plan. So, I think we've touched a lot upon a lot of things, and I hope that it brings some light to us as hygienists and the
Yeah.
hygiene world and dental world and why we do what we do and why we ask the questions we ask. Um,
It's really for your benefit. It's
for
not
the
for ours. We're
benefit.
not just checking the box. We're trying to put the pieces of the puzzle together so that we
Exactly.
have information going in when we look at your gums, at your tissues, at your teeth, at your saliva, at your tongue, at your lips, at your skin. We have a better understanding so that we
Exactly.
can help you achieve better oral health. And
Awesome.
with that, have a wonderful day and a happy health dose of happiness.
Happy, happy, whatever. Just happy smile.
Keep smiling.